It's important that your doctor appropriately selects not only if you're the right patient for surgery, which is one step, but also what type of surgery do you need exactly. As most of you know, I pushed the boundaries a bit on artificial disc replacement, trying to restore motion for patients, keep people active and functional, moving as we age. Sometimes I need to screen the patient before they come in. I don't want to waste their time if I look at their films and it's an utter impossibility to recreate or save motion. So I screen the films before I see them. I let the staff know if they're appropriate to come in, because I always want to hear the patient's story. So I sit with my patients, as you know, for an hour, and we're going to talk about you, your life. I examine you, and we make the appropriate plan for you based on your films, your age, your goals, and where you want to be 10 years from now.